Thank you very much for the stunning introduction. I wouldn't be mayor for anything. Thank you very much for having me and having Grand Lake. I heard about Grand Lake Mental Health Association a little bit over 5 years ago. And as you know, can tell from the pens that you've gotten, the name has changed. Grand Lake started in the eastern part of the state near Grand Lake. And when they took over the next 7 counties, which includes Payne County, it was too confusing to be a mental health agency called Grand Lake. It was always like a resort. I'm very happy to have Luke here. Luke is the Payne County Operational Director for Grand Lake, and he's worked in the mental health field for about 15 years and in Payne County for Grand for just a little bit over 5 years when they first came to our county. He currently oversees all the outpatient services for Payne County and works with community partners to better serve the community. His job is huge. Grand, when they first came, just to give you a tiny picture, when they first came to our 7 counties, I think they had 160 employees. Currently, just over 2,000. Yeah. Luke, all yours.
All right. Thank you. First off, I just want to thank everybody for having me today. It truly is a pleasure to be here and an honor to be here. When I get to talking about our services and mental health, it's something that I'm really passionate about. I'm going to do my best to make sure that I don't go over time or anything like that. But it's something that gets me really excited. If we were to all just take a second and think about mental health and kind of our relationship with mental health, if you've ever had a relationship with mental health, whether somebody in your family or maybe yourself that has suffered, I would bet it would be probably majority of everybody in this room, or if not everybody in this room. Mental health affects a lot of people, whether directly or indirectly, and it affects our communities. So I'm real proud to be a part of an organization that is working to make improvements and improving the quality of life for the individuals that we work with. So I want to talk to you guys about some of the services that we're providing here in Payne County. The list is really long, and I'm going to try to be as quick as possible to kind of give an overview of it, and I would really like for some questions. But when I first started here in Payne County in Stillwater, the main things we did was just counseling, some case management, and that was it. So our services were really limited, and it wasn't as vast as it is today. And like Pat said, our growth has been tremendous. But it's also helped to help more people. At that time, when we had 160 team members for the entire agency, we were really limited on the amount of people we could serve and help. And so now with 2,000, we've been able to help a large part of the communities that we're in. So starting off with Payne County, our crisis unit. We have a crisis unit that is here in Payne County. Under our crisis unit is the Urgent Recovery Care Center, and so the URC. What that is just like urgent care for medical. Maybe somebody's having a urgent mental health need, and they're needing to just take a break or possibly talk to somebody or get on some medications. And so an individual will come. They can voluntarily come into the URC and stay with us and get stabilized, or we may have to do a protective or a placement order in order to get them in there if it's something they're not sure they want to do, but they are maybe a threat to themselves or the community. The typical stay is about 24 hours. It's a 24/7 facility. It's located in the Cimarron Plaza next to Walls and the Dollar General over there. all of the law enforcement, something one of our partners, Pat talked about our partners, and one of our partners is law enforcement. So every law enforcement officer in Payne County has an iPad, has one of our iPads, and they're able to connect directly to a mental health professional. So now that's another tool for our officers. If they're responding to a call and they're having to go to somebody's home, maybe somebody's acting erratic or not sure what's going on with them. Now that officer has another tool and another option other than just taking them to jail. Jail may not be appropriate. It may be that they need that extra help, or they need to be monitored for a period of time, and they need to get on medications, or they're needing to get connected to the services that they need. And so I'm really proud that we've been able to do that, and we've been able to work alongside law enforcement to provide the iPads for them. Something new in Payne County, along with Crisis, is the Family Assessment Center. So Crisis with adults, there's a little more options that we have. With children, we're limited, and that's across the state. Statewide, we're really limited on when children are in a crisis. And so something that I'm real proud about, and it just started, we're one of 3 counties that have a family assessment center. And so what this family assessment center is it's a place now for almost like a cool down for when a child is in a crisis. And the whole family, so the entire family or caregiver and the child, they're going to come to the family assessment center where they're going to be supported by family support providers. And then there'll be a therapist that will continue to assess to see if they're still in a crisis, do they still meet criteria. The goal is to use the least restrictive placement for children, especially for children, because that can be traumatic as well too, having to leave your family and go to a hospital setting. So the state is doing a really good job of trying to find different layers instead of going straight to acute inpatient. And so we're working with the state, and we've been able to open up the Family Assessment Center. It also, what it does for the community, so it also helps the family, but it also helps the community. It now frees up a bed in the ER. So one of our partners is Stillwater Medical. We work a lot with Stillwater Medical. Prior to the Family Assessment Center, if a child was in crisis, a lot of times they would end up in the ER. And then it would take a bed in the ER away from maybe somebody with a medical need or whatnot. And the ER is just not set up for to handle that. They do an amazing job. They do a great job, but it's just not a comfortable environment and not a place where there are mental health professionals that are constantly working with them and checking on them. So when we opened it up, it might have been a day or two after we opened up. I met with the social workers at Stillwater Medical, and we were talking about the Family Assessment Center. And one of the social workers let us know, said, "Hey, we have somebody now. We have somebody now, a child that's in here. They've been in here for 24 hours, and it looks like it might be all weekend before we find a bed, and because it can take days before we find a placement." And so we were like, you know what? Let's test it out. Let's see. Let's call the crisis unit and see what we can do about helping this family. We were able to get them in there that day, and we freed up a ER bed and able to get that family in there and get them connected to the care that they needed. And so it was really cool to see that right after the first day or second day of opening it up. So it definitely is being used, and it's something that I'm really proud that we have here in Stillwater. So it's located also in the Cimarron Plaza. It's actually part of our outpatient building. So it's not connected. It's not in the URC where the adults are. It's separate, but it is still in that plaza. And so, yeah, so if a child is in crisis, reaching out to the crisis line, they'll give them that option, or even just come into the clinic if we're open, and we'll be able to help them out as well too. Something that we've had for maybe a little over a year now is the Addiction Recovery Center. So that's another thing. So back on with the adult side, the Addiction Recovery Center is a residential rehab facility in Tulsa. And we're real fortunate that what it does is it's able to get our clients connected to those services a lot quicker. So since it's all within our agency, a lot of our clients, even they don't necessarily even have to be clients. People will come into our clinic and we're able to kind of get them in sometimes that day or the next day into residential treatment. That's something that has been a difficult process as well. So when we have somebody who meets criteria for a residential treatment center, what we'll have to do is check the state website to see if there's any beds available and to kind of see where they're at. And then we run into an issue of transportation. Well, that's something that we've been able to work through, is being able to transport our clients when they come in, or people who are wanting to go to get that treatment from our facility to Tulsa, and then bringing them back once they've completed or completed the treatment. So the ARC is has about 180 beds, and we're looking to increase that. Even with that many beds, it stays full. It is really busy over there, and they're helping a lot of people out. Yeah. Oh, yes. So speaking of transportation, yes. So law enforcement, they did the transportation, and back in November, the law changed where law enforcement they couldn't, no longer transport, and it was up to 30 miles. And but it always was an issue too of like, I would have the police department and people reaching out saying, hey, like, I've got this officer, they're having to go to Arkansas to take a kid to a placement, because that's how difficult it was. We were having to take kids to a different state for placement when they're in crisis. And so now we've been able to open up places that are closer where we can transport them, and then we can also transport as well too. And so that's something that we've been working hard to do, which is now freeing up those officers as well too. And thank you for bringing that up. So also too, when a child or somebody was in crisis, the officer would have to stay with them until we found a bed. And so with the Family Assessment Center, they no longer have to stay with them. We have the staff that stays with them that are trained in handling that. So now it frees up an officer as well too. So it frees up a bed and it frees up an officer if they're having to wait with that individual. So so yeah, so it's I'm really proud that we're able to be able to do that. So as far as our outpatient services, we work with adult and children. We work with children all the way from 0 all the way up to 18, and then adults all the way up. And so as an adult, each adult that comes in and says, hey, I want services, they get a whole team. They don't just get a therapist. So we are integrated mental health. And so they get a team. They get a therapist that's going to be working with them. They get a peer recovery support specialist that'll be working with them. That peer recovery support specialist is going to be walking with them through that journey. It is difficult to say, hey, I need help, and then to navigate the mental health through mental health on what I need or what's best and whatnot. And that peer recovery support specialist is going to be right there with them through that journey. Then there's a care coordinator, and that care coordinator is exactly what it is. They're going to make sure that they're coordinating the care, that if it's medical stuff that's needing for that client, they're going to help them with that. If it's case management needs, they're going to help them with that. Those care coordinators, they do a lot, and they reach out to help find resources in the community and get the clients connected to resources. If we have an adult or a family who they can't eat and they don't have food, they're not going to be able to work on their mental health. They're not going to be able to work on depression or anxiety or any of that stuff. And so that case manager at that time is going to be the most important role to them. And they're going to connect them to those services. So that way we've got those basic needs taken care of. Now let's work on that depression. Let's work on that, So one of our partners is Our Daily Bread. They do an amazing job over there, and they are just so great for our community. So I'm really proud to be able to partner with Our Daily Bread. Some of the special kind of programs we have in Payne County for our adults, we have the assisted outpatient treatment. And what that is we're working with the judicial system to help hold clients accountable on making sure that they're receiving their treatment and that they're participating in the treatment. So whether it's medications, a lot of times that's what we see. We'll see clients that are they may be suffering with a severe mental health disorder, maybe schizophrenia or something like that, and they're delusional or probably hallucinate, and they get on their medications and they're good. And they're doing good for a period of time. And they're like, you know what, I'm good. I don't need these medications. We see that a lot. We see that, and they're doing great. And all of a sudden I'm good. I don't need to take these meds. And then next thing you know, they're in our URC or they're being arrested. And so what the assisted outpatient treatment does is it's working with the judicial system to make sure to kind of keep them accountable of making sure that they're taking their medications, they're working their treatment, and they're staying on track. And so we've seen some success with that here in Payne County, and being able to help clients, get that, kind of hold them accountable. And sometimes they need that, right? They need to be, and we do too, right? We need that little bit of accountability to make sure that we're staying on track. And it's a good way for that. Oklahoma Family First Project is a newer program that we've just recently started here in Payne County a couple months ago. And what that is it's working with parents that are expecting or postpartum up to 3 years. And then the parents are suffering from substance abuse or any kind of substance abuse issues. And so we'll be working with that client. We have specialized teams that will be working with that client and trying to wrap all the services and all the resources we can in the community around this family. So for one, they'll stay clean, and they're able to stay together as a family. And so that's real important is trying to make sure, that working with that family to create a safe environment so a child can stay in their home and they're not having to be removed from the home by DHS or anybody else. So we're working with those families on that. So working on the substance abuse, making sure they have the supports and the resources for them to be successful. We also help with the court system. So drug court, we help with drug court, working with the co-occurring. Drug court in Payne County, they're doing a great job. They are really doing a great job. I don't know if you all know Bagwell. They're doing a good job over there, and so we've been fortunate to be able to assist them and helping with the co-occurring. So if they have any of their participants that are needing medications or to work on some of the mental health needs, then we're there to help them out. So we used to have, with COVID brought in a lot of grants, right? A lot of grants, and there was so much money during COVID, right? And we had all this money and grants to do these different programs. And now we're at the end of COVID, and all these grants are kind of going away, and there's the money is just not there like it used to be with some of the programs. And so some of the programs that we do and that we're able to provide are through a grant. And I was really saddened to find out that our law enforcement EAP program was a grant that went away with COVID. And I'm just like, man, we've got to be able to do something more. And so several of the departments here in Payne County reached out and said, hey, we need some help. We need some support, and we need some help in Payne County and in some of the other counties as well too. And so working with them and then working within the agency, we've been able to bring it back. We've been able to bring back the EAP for law enforcement officers. And so that's any law enforcement officer. They don't have to give, there's such a negative stigma with mental health and like law enforcement and military. And so we've been able to find a way to be able to provide free services to those law enforcement officers that are just needing that extra help and just needing somebody to talk to. and EAP, yes, it's a assisted employee assisted program. And so EAP, a lot of companies and Stillwater Public Schools has an EAP, law enforcement EAP. And what that is if a employee is maybe needing some help or needing to speak to somebody because they're going through some things or have some stuff going on, they're able to do that through their HR. And so we also help with Stillwater Public Schools. That's one of our partners as well, and we help with their EAP. In supporting those schools, especially when there's something that tragic happens at one of the schools, then they'll call us and, hey, we're there. We're going to be there to support you all. What is it that you guys need? And we'll be there. And so, working with the school system, but also law enforcement as well. A lot of the officers don't want to, provide a whole lot of information, and that's okay. We're able to work with them, and they don't have to provide all that information. We don't bill their insurance. We don't even talk to their insurance or any of that stuff. So same thing with the Stillwater Public Schools. We don't share that information. We don't. It's all confidential, and we don't send them a bill or anything like that. That's part of their HR and part of their program. So it's great to be able to help them. And so with the law enforcement AP, we got it started actually here in Stillwater is where we kind of got it started back, and now it's spreading across the agency, which is great. So working with law enforcement has been amazing because they've done so much for us as well too. Back when they were transporting all of our clients, or if there were things that we were needing, they've always showed up. They've always showed up. And so to be able to give back and to help them out is truly an honor. So child welfare. So we do work with DHS. And so if we have some parents that are working through a safety plan with DHS and they're wanting to get their children back, maybe the children are removed, we're going to work with them. We're going to work with them and help them to get to a place where there's a safe environment for that child and we can get that family reunited. We also do the medication assisted treatment for the opioid use disorder. So if anybody is suffering from issues with opioids and addiction to opioids, we will provide that treatment. And what that treatment is using medications such as Suboxone along with therapy to help clients in recovery for opioid addiction. So now I'm going to talk about the children. So this is children's program is near and dear to my heart. That's where I started with Grand. Is I was a therapist and worked with our children here, and so both programs are really important, and they both go together, right? We got to work with the parents as well, but children's is where I started, so it's kind of where I got a real soft spot for the children's program. And so each child is assigned a team as well too, the child and their family. So it's not working with just the child, we're working with the family. And they get a therapist, care coordinator, and then sometimes a family support provider if they're in wraparound. Wraparound is a program that has shown a lot of success. And so what that is that's for maybe more intense children clients. They're suffering from, from pretty severe behavioral problems or some mental health issues that are going on. And we're gonna wrap that family up with all the supports that we can get. Wraparound is exactly what the name of it. We're gonna wrap them up with everything. The team, they're gonna create this team that is gonna be supporting this family, and they're gonna be meeting with them. They're gonna be meeting with them every 4 to 6 weeks. Making sure the family's on track and if there's anything they need and what they can do to better support this family. I've seen support teams made up of law enforcement officers, DHS workers, school personnel, people from church, family members. We are reaching out to anybody who can, is willing to support this family and seeing if they would willing to join the team. And help this family as they go through the journey of to help with the child. So And we've seen a lot of success, and where families, they no longer need that. They get to a point where they no longer need all of that support, and they're able to maintain, and they have the tools that they need to address behaviors, or if there's any mental health symptoms or anything like that, they're able to have the tools to address that. Strengthening families. So strengthening families is it's a program we started, and we just started. So we were getting ready to start it right before COVID. COVID hit, and then it was just, we couldn't be, we had to be far away and whatever else. So strengthening families is a group that is with families, and it's set up kind of like this, where there's tables, and each family is at a table, and we're having a group with that entire family. And part of this group is having a family dinner. I am amazed on how many families are no longer having family dinners, and not having that, right? And to be able to start that tradition, and start that with some of these families who have never ever had a family dinner ever in their children's lives. And so starting that, giving each other that undivided attention, putting the cell phones down and putting the electronics down, and communicating and becoming a family. And so we just finished our first group this last month, and we're starting a new one. We've already started a new one, and the families have been so thankful, and they did such an amazing job, going through this group and learning and being open to learning how to spend that quality time with their family. And so I'm really excited about that. Infant mental health. So we have teams here in Payne County that are specialized in infant mental health, and so they're working with children 0 to 5 years old. And so they're actually working with the family, and they're trying to build that connection and that bond, and making sure that bond is strengthened, so that later on in life that child is able to be successful in building relationships, and they just have a chance, right? And so that's something that I'm real excited about our team. We do work with Stillwater Public Schools. We have embedded teams there. So we have teams that are in the schools working with the kids. We have behavioral health coaches that are in the schools as well, which is really great. Some of the additional services, I was just looking at my time, and I'm cutting it close. So our case management. So we have a housing department, and we're trying to help our clients find housing. And we also have employment specialists that are working with our clients to find employment. We also do have a medical team. We have a medical team here in Stillwater, and we're providing medications. And we just recently opened a Spravato clinic. So Spravato is a medication. It's a nasal mist that's for clients who have major depressive disorders. So severely depressed clients, we have our clinic in Tulsa. We encourage family members to take them there, but if we need to help provide those transportation, we'll do that. It's a nasal mist that they do. They start out doing twice a week, and then eventually go to weekly, and then kind of taper off as they go, and may need it, depending on how long and how severe the depression is. There has been so much really good research on how Spravato has been able to help with depression and severe depressed people. So people who have been like, I'm a 10 with depression. And he says, where are you at? 0 to 10, where are you at in depression? I'm a 10. And they're always saying they're a 10, have been able to go down to a 0 or a 1. So really amazing. I'm really proud that we're able to do that and offer that to our clients that we serve. And so now I'll open it up to questions. If anybody has any.
Tell us about the new building.
Yes. So currently we are in 2 locations. We are on 6th and Walnut, and in the Cimarron Plaza. So it could be really difficult being in 2 locations. And we are moving 2024. That's what I'm gonna keep saying it. 2024, we'll be moving to right behind Atwoods in that area where Cowboy Apartments, they built the new car wash. It'll be a one-stop shop. Everything will be in there. And so, yeah. Yes. So yes, yeah, exactly. So we can be able to serve our clients, and they will need to go get their car washed. It's right there. So I am really excited for us to be able to move all together finally as a team, and to be able to have one place for clients to go, so they're not having to go to this place for medications or medical, and then this place for their therapy and whatnot. So I'm really excited that 2024 will be moving to that location. Yes, sir.
So 2,000 employees, I'm assuming that doesn't count any volunteers you might have, right? I mean, these are paid employees. So what is your annual budget, number one, and number two, where does it come from?
So our funding is through grants. Our annual budget for the agency, I don't have the information to speak on that. But our funding comes through grants. And also we are a certified community behavioral health agency. And so that is a huge contract that we have with the state, working with Medicaid and DMH clients. Also, if clients have insurance, we are billing insurance as well too. We see every insurance. So there's not an insurance that we don't see. Also, if clients don't have insurance, we're going to try to get them set up with Medicaid. And if they don't qualify for Medicaid, DMH, Department of Mental Health, will cover that cost.
The fact that they take private insurance if you've tried to find a counselor or a therapist who takes private insurance, it's amazing. It's much easier to get a Medicaid patient or a Sooner Care patient than a person who's got a United Healthcare. So that's huge.
A couple of years ago, if I remember correctly, the federal government, in response to gun violence, included funding for mental health. Have you been able to take advantage of that funding? I can't recall the name of the act, but has that funding made an impact for you?
So yeah, and part of the being a CCBHC is federal dollars. So they will give that to the state, and then the state kind of distributes it or through that. So part of our funding is through that as well.
So I've got a question for you also.
Mhm.
We've got a homeless population here in Stillwater. We don't exactly know how big it is. I've heard small, I've heard large, depends on who counts. But within that population, I understand mental health and addiction are major issues. So if somebody's homeless and comes to you and we are find a way to get them some treatment, do you have a way to get them out of the homeless situation to provide them someplace to live? Do you have some help for that?
So that's something so we do have a whole housing department that they are working to find housing for that client. What we run into sometimes is the clients, they don't want housing, and they're happy and they're okay with being homeless. And some clients they'll want housing, and we'll get them on the housing unit, our housing team. Back when COVID, we had all these grants for housing, and that's a lot of what we use for our housing team. And sometimes it's kind of hard to find housing, especially in Stillwater. There are some barriers with finding housing here.
And one other question, same guy.
Mhm.
Do you work with the tribes? Because I know the tribes have some mental health services also. So do you interact with them?
Yeah, so we will work with the tribes and partner with them. Sometimes depending on where the location of the client is, and if the client is wanting to work with the tribe on mental health stuff, then we'll make that referral to the tribe. Also with like the tribal DHS, they'll make referrals to us sometimes as well too, and we'll work with them on whatever their needs are. And sometimes they get an increase in clients too, and they just don't have enough staff to work with the amount of clients, and so they'll send us referrals as well.
Thank you.
Let's give Luke a great big hand.
Thank you. Thank you.
Thank you.